All right, this is lab 4, looking at the skeletal system. So this is page 8 in your lab packet, in the blank lab packet that is. And what I have pulled up here on the screen are the flashcards that are in your Blackboard folder for this week. So looking at the first objectives, classifying bones by shape and recognize an example of each. This is on page 176 of your textbook. And if I look at these bones here, I can see there's a long bone, which is this one. And I can distinguish long bones from the body. They make up the limbs, the arms and the legs, right? They have a long shaft with enlarged ends. So we see this long shaft here, which is characteristic of a long bone. And so examples of this would be the femur, the humerus, the radius, the ulna, the tibia, the fibula, all with long shafts. So the arms and the legs. And then the other one is the short bone. A short bone is short, stocky, does not have a shaft, so that's what letter D is. An example of where we find short bones would be like the ankle bones and the wrist bones. So those bones glide past one another and they allow you to rotate your wrist and your ankle. And then the flat bones are flat, so they don't have a shaft. They're not thick like a short bone is. And a good example of that is the sternum. So the sternum is a flat bone, has a very narrow diameter, filled with spongy bone. Also, another example would be the bones of the skull. The bones of the skull are flat bones, and they come together at sutures to protect our brain. And then irregular bones are just bones that have kind of an irregular shape. They're not having a real repeating pattern throughout the body. So the vertebrae are good examples of an irregular bone. So here, this is a lumbar vertebra we're going to talk about today. And that's an example of an irregular bone. So just an irregular shape, no real repeating pattern. The sphenoid bone is another bone in the skull we're going to talk about. Another good example, does not have a regular repeating pattern. It's just a single bone, kind of has a butterfly shape, and we find that in the base of the skull. So we'll be talking about that a little bit later. So be able to classify them. So the key word and objective number 1 maybe to highlight is what you might see on a test question would be, how would you classify this bone? And then your choices are long, short, flat, and irregular. Okay, now objective number 2, this is on page 178 of your textbook, looking at the parts of a typical long bone. So the long bone has a diaphysis. So this little mark right here would be referring to the diaphysis, which is the long shaft of the bone. So this is the diaphysis, this whole region here. And notice that diaphysis is carved out in the center. There's a hollow cavity inside that's filled with yellow marrow. That's what this is, which is mostly adipose tissue, so it's fat. And if you give a dog a bone, like a little sliced round bone, right, you can see that marrow inside there. They love that part because it's fatty, has a lot of flavor. So this is the marrow, or yellow marrow inside the medullary cavity. So the cavity, so that's what this leader line is pointing to, is the medullary cavity, and it's filled with yellow marrow, so you can draw your own leader line to that. Yellow marrow, medullary cavity, and the whole region here is the diaphysis. And what we find lining the outside of the ends of the bones is articular cartilage. So you see this kind of light blue layer here, and then a light blue there. That is hyaline cartilage that's permanent in the sense that it never is converted to bone. It's just a permanent layer of cartilage that lines our bones at joints and provides less friction when we move our joints. It also provides some cushion, so when you're running, jumping, walking, there's some absorption of force there. Now, if a person plays sports for a long time or likes to be an ultra runner where they're running 100 miles, I think there was one this weekend, the Goosebumps, where people run for 24 hours straight as much as they can. And that's hard on the joints over time because that constant impact. So people can wear away their articular cartilage. And that's the #1 reason why people go in for joint replacements. Hip and knee replacements are because they wear away the articular cartilage, and then you have bone on bone, and that's very painful. And then the bone actually starts to become shaped differently. And now you look at a person with bad knees, and their knees kind of bow out to the side because they've worn away the bone on the inside from contact. And #1 cause of hip and knee replacements more knee than hip. Number one cause of knee replacements is lifelong obesity. When the skeleton is carrying extra weight over a lifetime, that wears away the knees. So if you look at a typical patient for a knee replacement, they're typically obese and have type 2 diabetes, which is another risk factor that's related to obesity. So a risk factor for knee replacement is infection. When a person has chronically high blood sugar and they have a knee replacement, any bacteria that might be around that newly replaced knee thrive in that sugary blood sugar environment, and it causes infection. And I know when I've worked in the nursing home and even in the hospital, I have patients that are diabetic that have lost their lower leg from knee replacements that got infected. So, and I had an orthopedic surgeon tell me when I watched a knee replacement in nursing school, which is awesome. Western is really good about getting you in to watch surgeries while you're in nursing school. It's really cool. So this orthopedic told me, he said, whenever we have a diabetic patient coming in for a knee surgery, it's extra risk factors for infection. We have to be really, really careful, and we have to tell that patient to be smart about caring for their incision and all that because of the infection risk. So articular cartilage is something we want to protect and respect. And movement is a way to keep the articular cartilage healthy. Some people say, oh, I have bad knees, that's why I don't exercise. It's kind of a vicious circle. You could say, well, you have bad knees because you don't exercise. So a little bit of movement, a little bit of walking is important for the joints to keep them healthy, to keep fluid in that articular cartilage and keep that articular cartilage supple and functioning properly. When we don't use them when we don't move around is when our joints get worse because there's less fluid in a joint. At my age, I just do light running, and my knees are healthier today in my 40s than they were when I was in my 20s because I didn't know as much as I did, and I thought, oh, my knees are bad from high school sports, so I'm just going to not run. That was not good for my knees. They felt terrible. So that's the articular cartilage. And then the ends of our long bones, so each of these brackets is referring to the epiphyses. So the diaphysis is the shaft. The enlarged ends are called the epiphyses. Epiphysis, if it's singular. So end starts with an E, right? And epiphysis starts with an E. So you can remember it that way. Ends, epiphysis. And when I look at the lining of bone, the layer of cells that line the inside and outside of bone, the outer layer, which is what this leader line is pointing to, this outer layer of bone made up of bone cells is called periosteum. Periosteum is the outer layer of bone. And then lining this inside cavity here is endosteum. So endosteum is the inner lining on the inside of our bones, lining the medullary cavity. So periosteum on the outside, endosteum on the inside. And you're going to see that repeating prefix in our class in lab throughout the semester. Peri is always the outer layer, endo is always the inner layer lining the inside of organs, or bones in this case. So moving on to objective number 4 then, this is all still on page 178 of your textbook. Spongy bone is the type of bone we find in the epiphyses. So this leader line here is pointing to the spongy bone. Spongy bone is not solid bone, like this is compact bone here, right? So this leader line here is referring to compact bone, solid bone, no air spaces. And that has that kind of those targets or circular appearance in the tissue slides that we looked at for compact bone. We'll see that spongy bone looks different in a tissue slide. We're going to look at that in a minute. So this is spongy bone found in the epiphyses, and instead of yellow marrow or fat, what we find in this area, in this spongy bone of the epiphyses, is red marrow. So this is where we form our red and white blood cells. We need that red marrow in the epiphyses for that process of making new cells, because our red and white blood cells have a lifespan. They don't live forever. They can live up to 3 months, but then after that, it's time to make 3 to 4 months. It's time to, for especially red blood cells, it's time to make new ones. So when people have leukemia, which is cancer of the white blood cells, so basically their white blood cells start to divide out of control and it fills this spongy bone, what do you think one of the symptoms is when you have bunches of cells packing the inside of your bones? What would be a symptom of that? What? Pain, yeah, bone pain is one of the symptoms of leukemia because those cells are growing out of control. And those white blood cells are not good functional cells, so it causes a weakness of the immune system. So kids with leukemia and adults too, young people, end up with fevers, infections, bone pain, all symptoms of leukemia. And that's where people would get a bone marrow transplant then, where they would kill the bad bone marrow, the cancerous bone marrow, and replace it with healthy bone marrow from a donor. And the place where they go for that donated bone marrow is in the flat bone of the hip, because in the long bones, there's yellow marrow, right? Where do we get good red marrow? In the epiphyses of our long bones and in our flat bones is where we find red marrow. So the hip is a good rich source of that, and it's easily accessible. But it is painful because we learned in lecture that bone has a good nerve supply and blood supply. So when we dig into a bone, it hurts, and that's one of the drawbacks for the donor of the bone marrow. It's pretty painful to go into that hip and grab that bone marrow for the person who needs it. Okay, so spongy bone is filled with red marrow. At our long bones, in the epiphyses, is a special area of growth during puberty, so your bones get longer as you grow, and this is called the epiphyseal line or plate, depending if it's complete or still growing. If it's still growing, we call it a plate, and there's cartilage found here. So in this spot right here, there's cartilage. As it makes bone on one side and the cartilage stays on the other side, it grows longer. But once it's done growing, then it's all bone, and that's what we see here. We just see all bone. We don't see any blue cartilage. We just see all bone in this line right here. This is called the epiphyseal line. So if you look at an x-ray, I'll pull one up on the internet here. Another name for these is the growth plate. So if you go to the doctor, a kid breaks a bone and it's at the growth plate, that can be dangerous because that might interfere with the growth of that bone. So here we see the wrist. So here's the humerus and the ulna. I'm sorry, the radius and the ulna. So here you see this dark line here. This is cartilage. So this is the epiphyseal plate. So this bone is not done growing yet because I can see there's an area that did not absorb the x-ray. Only bone is going to absorb that x-ray and get that nice white appearance. The dark line is hyaline cartilage that has not absorbed the x-ray. Here I can see a region here that's not completely fused yet. Now if we go back, we can look at some other ones here. Here's another one, definitely a real visible dark line there, so that's the epiphyseal plate or growth plate that you've heard of. Here's at the knee. I can see there's a epiphyseal plate here, this dark line. And if I compare that to an epiphyseal line, where it's done growing, you can see the difference. It's kind of small to see, but let's see if I can find a bigger one. Here I can see just a line, just ever so bit of a line there. So that means that bone is done growing. Let's look here. That I can see, let's see. That one looks like a little bit of a plate left there. But you get the point that it's pretty much done growing. Here again, I'm not seeing a real visible plate. I'm seeing a line. I see a line here and I see a line here. So this bone is done growing. All right, and then if we look at what bone is made out of, bone is made out of calcium or cartilage. So calcium is what makes bones hard, and collagen is what makes bones flexible. So if I look at a bone without enough calcium, it's going to be rubbery and not supportive. So a rubbery bone is collagen, full of collagen, but not enough calcium. And a hard, brittle bone is no collagen, only calcium. So if I look at this bowl here of bone fragments, this is bone that's been baked. Like when someone is cremated, this is all that's left. We burn away all the proteins, and all that's left is the calcium fragments in the bone. So this is very brittle, dry bone, and that's calcium only. This is a bone, a couple bones, that have been soaked in vinegar. And if you feel them, I can bend these bones because they're so flexible. The vinegar binds with the calcium in the bone, and the collagen is the primary component that remains. So this pulls, the vinegar pulls the calcium out of the bone and leaves just collagen behind. Acids bind to calcium. So when a woman says, well, I'm going to drink diet soda because, you know, it's better for me, lower calories, right? If you look in that diet soda, there's phosphoric acid in that diet soda. That acid solution that she's bringing into her system binds calcium and contributes to weakening bones. So it's not a good idea to drink diet beverages, soda in general, because they're acidic. Same thing with coffee. Coffee is an acid and can contribute to osteoporosis. So for people that are at risk for osteoporosis, they want to make sure they're limiting acid. Like there's the apple cider vinegar, you know, diet or supplement that they tell people to have with meals because it helps, you know, detox and burn fat. But people have to really be careful with that because they put themselves at risk for osteoporosis. So I'll pass those two around. You can feel the difference. So collagen makes bones flexible. Calcium makes bones hard. So that's described on page 183 of your textbook. We don't really have a picture other than those two things that we have here in lab. So page 9 then is looking at microscopic structures of bone. So this picture is page 189 of your textbook, or 181, sorry, 181. Has some nice pictures of the microscopic components of bone. So here we can see this part right here is compact bone, and it's just a small sliver of this shaft of the long bone. So you can see that little highlighted area, that shaft. This is just that shaft blown up. So here's the lining of the medullary cavity here. So we're kind of zeroing in on this portion here. So we can see these repeating circular units here. These are called osteons. So these are osteons, those repeating circular units. And we have some models here. And I put these on Blackboard. I'll show you a picture of that. Thought I had. This doesn't seem to be working. All right. All right, so this is one of the bone models we have in lab. So this again is the outer margin. This whole thing is the outer margin of our long bones in the diaphysis. So each repeating circular unit here, so this whole series of layers forming a circular, like a target, you know, appearance is called an osteon. So this whole thing is an osteon, but each individual layer has been pulled up to look like a wedding cake. But if I push these back down, it would look just like this. Okay, so that's an osteon. And then in the center of each osteon is a hole, and running through that in a living bone, we can see here, there's a red and a white structure in there, and that's a blood vessel and a nerve. So in the center of each osteon is a blood vessel and a nerve, and we call that central hole the central canal or Haversian canal. And then each layer of bone going from the Haversian canal out to the edge of the osteon, each layer of bone has been laid down by an osteocyte. So these parts of bone are all dead, but here on the edge here, see the black dots? This is a living part of bone. This is just giving you an example of what it would look like if this bone was still living. And each little black dot is an osteocyte. So these osteocytes are bone cells that lay down each layer of bone. So the newest bone is in the center. The oldest bone layers are in the outside of this osteon. So each of these black dots is an osteocyte. Cyte means cell. Cyto, right? Cytokinesis, cytoplasm, all refers to cell. So these are bone cells that make the layers of bone. And each layer is called a lamella. So think of the word lamella, meaning layer. Lamella. Lamella is a layer of bone in an osteon. And then when the bone dies, and these osteocytes dry up because they're full of fluid and proteins, and when things die, bone becomes very brittle as those cells die. Then we just have the cavities where those little osteocytes resided in the living bones. You can see these little open spaces here. These cavities in the layer where the osteocytes once were are called lacuna. So the hard C, lacuna, means cavity. So it's just the space where those osteocytes did reside when the bone was living. So lacuna, cavity. Lamella, layer. 2 L words. And then these osteocytes, if you can look closely here, they have little extensions, little cellular extensions that allows them to release waste and gain nutrients from other layers of bone through those little cellular extensions. The little cellular extensions are called canaliculi, which means little canals, because it's like if we were all trapped in cement where we are, we could feed and water ourselves by passing things along with our arms, right? Our arms would be like canaliculi, where we'd be communicating from cell to cell, transporting nutrients and giving off waste. So when the bone dies, can you see these hazy little white, little not white, but little indented lines here in the lamella? Those are from the cell processes of the osteocytes before that bone died. So these little hazy lines are called canaliculi. But I could also point to an osteocyte and say, name these little structures, these little thin extensions coming off the osteocyte, and the answer there would also be canaliculi. Okay? So either way, cellular extensions we call canaliculi. So then if I look at another view of this bone, this model here we have in class, and this is just one osteon. So it's not a whole bunch of osteons like in the bigger model, but this is just one osteon. Here we can really see the canaliculi nicely. See those red extensions? See in the dead portion of the bone where there's just cavities, no osteocytes, so the light blue cells are the osteocytes. Here those cavities are empty because the bone died. So what are these called, the empty cavities? Lacuna. And the little strands or indented fiber lines are what? You can't hear? No, the layers of bone, each one of these layers is a lamella, but the little fine fiber lines indented in the lamella is canaliculi. Yep, thinking of little canals. So we have lacuna are the cavities, canaliculi, the little fibery fibers. Each layer is a lamella, and the whole circular repeating unit is a osteon. And the central portion here with the blood vessels and nerves? Central canal. So this is a nice model. We can really see the canaliculi here on the side. Here's the living cells. This is an osteocyte. So be aware of how to label that model or look at that model too. So looking back, this is a side view of that first model I showed you. So we said that bone has a rich blood supply. Well, where does that blood come from? It comes from the general circulation, from the outside of that bone. So blood comes in from the blood supply, from the outside, and goes through the center. So each one of these vertical blood vessel passageways here are central canals going through an osteon. So each osteon, has that central canal, and this blood vessel will come right up through the center of it. But what connects each central canal to make it with the rest of the blood supply are these horizontal blood supply lines, and that's the Volkmann's canal. So they're called Volkmann's canal, the vertical lines coming through that bone. Not vertical, horizontal. So here in this model I can see the horizontal lines here that go through the bone from the outside. So if a person breaks a bone, there's going to be bleeding inside that bone, right? So if I look at a person that maybe broke their bone, I should see swelling and bruising, kind of pinpointed, real localized, not the whole joint. People twist ankles all the time. But if they break a bone, you're going to see really localized swelling and bruising is classic. And it'll be very painful to move because the nerves are damaged as well. So when they cannot move it, that's a classic sign of a break. Versus a sprain, you can move it a little bit, it still hurts, but when you literally cannot move it because it really is sharp shooting pain in one localized area, you know that's a break. So a person can get a blood clot as a result of a broken bone, and that can enter the general blood supply because these Volkmann's canal will carry that blood clot into the body, and they could end up getting clogged in an artery of the lungs, the brain, or the heart. So that's pulmonary embolism if it's in the lungs, they can die from that. Stroke if it's in the brain, and heart attack if it's in the heart. So it's important if someone has a bad break to be seen and not just let that blood clot risk cause more complications. Okay, so moving on then to, so now we looked at the microscopic anatomy, or in a model form. Now we're going to go back and look at it in a slide. So here's just a diagram from your textbook. Central canal. Each layer is a lamella, osteocyte, canaliculi. The open spaces that these osteocytes sit in we call lacuna. So you can just practice with that. So here's a slide. Now we're going to look at the slide and put some detail to it. So up to this point, all you had to know is compact bone, right? Where it's found, the margins of long bones. Now we're going to look in some details. So these two lines here are pointing to what? These black things. Lacuna, or if it's a living bone, osteocytes. So you'd have to really read the question for the lab test. Are we asking you to name the space or the cell that's found there? So just really be careful when you get to that lab test of what we're asking for. The space or the cell. And then what is this pointing to here, this one? Central canal. So if I look at my objectives on page 9, anything with an asterisk there for Roman numeral 6, you have to know on a slide. So I have to know that this is compact bone. I have to know what the central canal looks like, and I have to know what an osteocyte and an osteon is. So you don't need to know any more detail than that. So you have to know osteocyte, central canal, and then a layer of bone is called a lamella. So any one of these layers is a lamella. Do you have to know that though for the? No, not on the slide. Okay, what was the other one? Osteocyte. Oh, osteon. This whole repeating circular unit is an osteon. So you have to know that. So osteon, central canal, osteocyte. And that's it for detail on a slide. So anytime there's an asterisk, you need to know that. So here's spongy bone. Spongy bone looks a lot different, doesn't it? Because we have fibers of bone, like a sponge. So this is the bony fiber. So what's pink with these osteocytes spread apart from one another, because this is a connective tissue, so there's a matrix, which means my cells are not going to be packed together. There's going to be space between them. So this is an osteocyte. This bony portion here is called a trabecula. Trabecula. So the bony fragments that make up spongy bone, those little bony fragments we call trabeculae, or looking singular, it's trabecula. So what fills the spaces in the epiphyses of bone? What did we say is found in there? Red bone marrow, right? Red bone marrow. So these open spaces here, this is where the air would be in a dead bone, but if it's a living bone, we would see red bone marrow. So what we see staining dark purple are the nuclei and the cells that we find here, which are red and white blood cells. So white blood cells, some of them have very distinct nuclei, so they're going to pick up stain. So this is red bone marrow. So if you see a slide like this, test question could be name this tissue, and the answer would be spongy bone. Or if there's a pointer in the pink area, you would say trabeculae. Or if there's a pointer in the open space white area with the purple dots, then you would say red bone marrow. So those are the three things you need to know for spongy bone, the details. All right, and then the next part is looking at cartilage. Cartilage is found lining our bones at the joints, right? That articular cartilage. So we have to revisit that tissue. What's the easy way to remember hyaline cartilage, did we say? Fisheye soup, okay? So all you have to know with hyaline cartilage is just hyaline cartilage. Just remember that this is one of the tissues that is part of the skeletal system. So here's another tissue that's part of the skeletal system because it attaches bone to bone and muscle to bone. What is this tissue? What is it? Yeah, dense regular collagenous, or another name for it? Fibrous. So letter A is pointing to the nuclei. They didn't stain well in this slide, but these would be fibroblasts. So you need to know fibroblasts. Those are the cells that make the protein, the collagen in this tissue. So these red bands here are all collagen fibers. That's what letter B is pointing to, are the collagen fibers. So now not only do you have to know the name of this tissue, but you have to know the details within that tissue. And that's fibroblasts and collagen fibers. So the fibroblasts are the cells that make collagen.
So A was the
Fibroblasts.
okay.
Yeah. And if you print these off, I'd recommend coloring them in like a dark purple because this particular slide, it didn't stain well. The cells must have dried up so there was nothing to stain, but that's where they would have been had they been there. You'd see dark lines there. And then fibrocartilage. And what's unique about fibrocartilage, it kind of looks like fisheye soup, but you're going to see more of wavy lines because the collagen fibers are really thick. So if you look closely, you can see there's these kind of hazy, wavy lines. They're not quite as smooth as fibrous or dense regular collagenous. So this is cartilage. Again, notice that the cells look like fish eyes. So this is another type of cartilage. It's called fibrocartilage, and it's a tough, thick collagen cartilage because we don't see collagen fibers in collagen or cartilage. We don't see collagen fibers in cartilage other than fibrocartilage. So collagen fibers present in cartilage. So this is a special type of cartilage, and we find this in the pubic symphysis, which is the cartilage between the hips and the front. And we also find it in the intervertebral discs in between our vertebrae of our spine. So a lot of pressure there. So this is a very strong cartilage to support that pressure of our spine and the different vertebrae moving against one another. It gives the spine its flexibility. So there's a picture of osseous. So objective number 7 on page 9. There's a picture of osseous or compact bone with the osteocytes on page 136 of your textbook. There's a picture of the hyaline cartilage on page 134 of your textbook. There's a picture of the ligament with dense regular collagenous or fibrous tissue on page 132 of your textbook. And then the fibrocartilage is on page 135 of your textbook. And depending what edition you're using, it might be off a page or two, but you'll find it in that general area. All right. So looking at the axial skeleton then, this is pages 10 and 11. So this is from your textbook. We have 2 major regions of the skeletal system. The axial skeleton is kind of like the central framework of the skeletal system. So it's shown in green here. So the axial skeleton is made up of the skull, the spine, and the rib cage. So it's the main frame of the skeletal system. And that's what we're going to focus on today. So we're just going to talk about all the bones that make up the skull, spine, rib cage. So you have to know the parts of the axial skeleton. So objective number 1, skull, vertebral column, thoracic cage. And know the word axial. If they say, what major region of the skeletal system is shown in green, the answer would be axial. Okay, so then we're going to move into the first few bones that make up the axial skeleton, starting with the skull. So we have the major bones that outline the skull, that encase the brain. So we have the frontal bone, which is looking right at us here in yellow. That whole region, the bone of your forehead, is the frontal bone. And then on either side of that are a pair of parietal bones. So if we look at the top or side view of the skull, this is the parietal bones. There's two of them, one on each side. So that's kind of where your hat sits. The sides of your hat, you know, or toward the top are parietal bones, and then the frontal bones, the front of the forehead. And then the temporal bone is down on the side of the skull, and there's a hole there for your ear canal. So that's the temporal bone. And there's a couple of different parts that you need to know of that temporal bone. So what I'm going to have you guys do is make sure you have a skull to really label and look at as we go through here. So the temporal bone then, we talked about the ear canal. The name of that is called the external auditory meatus. External auditory meatus is that hole in the temporal bone that in a living person is lined with a mucous membrane that secretes wax or cerumen instead of mucus. So that's your ear canal. And then you can kind of use that as your central reference point. And coming off in front of the ear canal is the back portion of your cheekbone, which is called the zygomatic process. So you can feel that if you put your fingers by your ear canal and then kind of pinch forward, you can feel that bar that comes forward to form the round part of your cheek. So it meets with the round part of the cheek, which is a different bone. But this is the zygomatic process. And a process is any projection that sticks away from bone. So zygomatic process. And below that is another process. It's very thin, small. This is called the styloid process. So you've heard of a stylus that you can write on your smart pad or your smartphone or your iPad with. That's where that comes from. It looks kind of like a pencil. So that's the styloid process. Not every skull model we have has that. Sometimes they break off, especially in a real one. But that's the styloid process. And then behind that is a very large, massive process, which is called the mastoid process. So there's three processes or projections coming off the temporal bone. There's the zygomatic process here, styloid process here, and mastoid process here. And again, all at the center of that is the external auditory meatus. And then there's one other piece that you have to know, and that's this groove here that the jawbone sits in. A groove in bone where another bone fits in and articulates or moves against that bone is called a fossa. So if you look at the skull model you might have in front of you, it fits right into that fossa. There's a little groove. If you take that jaw off and just put it right in there, there's a groove there. The mandibular fossa. Again, that's part of the temporal bone. So it's between the external auditory meatus and the start of the zygomatic process. So it's just this U-shaped groove right here. And again, that's called the mandibular fossa, because this whole jawbone is called the mandible. All right, and then we have the occipital bone, which is brown here at the base of the skull. And what we find that's a unique feature of the occipital bone is this very large hole, and a hole in bone is called a foramen. So it's a large hole. Some are small holes. This is a really large one. So that's why it's called the foramen magnum, because it's a large hole. And what goes through that hole that we know? The spinal cord. Yeah, spinal cord. So that's the foramen magnum. And then on either side of the foramen magnum, put your fingers on those two swellings. That sits on the first vertebra of the spine, called the atlas, and it rocks the skull. The skull can rock on those two bony projections, so on those two swellings here and here, and that allows us to nod our head yes. And those are called occipital condyles. A condyle is another grooved surface on a bone where another bone articulates with it. So the ability to nod your head yes is the result of the skull rocking on these occipital condyles on that first vertebra we call the atlas. So there's a pair of those. Then if we look at the inside of the bone, so if you take the lid off, take the top of that skull off of your skull, and we look down inside of it like this, we see a butterfly-shaped bone, or it looks like a bat kind of here. So it forms the bottom of the eye socket, and then there's this central portion here. This is called the sphenoid bone. The whole thing here is the sphenoid bone. And in the center of the sphenoid bone is a little U-shaped seat that you can actually stick your finger right in there. You put your finger in that U-shaped seat. Do you see that there? The pituitary gland sits in there. So the pituitary gland is hugely important for secreting hormones that control the endocrine system and maintain homeostasis. So it's a really important gland. It's completely encased by bone, which is great to keep it safe and functioning. And this little spot where it sits, somebody thought it looked like a seat for someone who lives in Turkey. What kind of geography do we have in Turkey? Do you know? Middle East? What do they ride around in the Middle East? Camels, yeah. So it's called, if we interpret the actual name of it, Turkish seat, which is like the seat, a U-shaped seat that you would put on a camel. So it's called the sella turcica, and that is interpreted as Turkish seat or Turk's seat. Sella turcica is the name of the structure right in the center of the sphenoid bone. So right here, sella turcica. And the whole thing, the whole bat wing looking bone is called the sphenoid bone. So two S's. Sphenoid with the sella turcica as a part of the sphenoid bone. And then in front of that, here at the top, is the ethmoid bone. Let's see, do I have another view of this? No, okay. Right here on the top is the ethmoid bone. So it's kind of like the head of the bat wing up here. So this is the ethmoid bone, and the holes on either side, there's a ridge here that divides the ethmoid bone, but the little holes in the floor of the ethmoid bone, together collectively the floor of that bone with the holes in it is called the cribriform plate. Cribriform plate. So those little holes are passageways for nerves from the brain to go down into the nasal cavity to sense smell. So the olfactory nerves for smell leave the brain and pass through those little holes into the nasal cavity. So that's the cribriform plate. So the floor of this with the holes, and it's part of the overall ethmoid bone, which is the whole bone here. Then if we look at a side view, or a front view first, I guess, of the sinuses. Sinuses are holes in bone, spaces, large air spaces in bone. It makes the skull a little more lightweight. But if you have a really bad cold and get a sinus infection, these spaces filled with thick mucus, and it causes a feeling of pressure and fatigue and overall illness when someone has a sinus infection. So there's a couple of different sinuses. So when I look at this diagram here, what bone is this here? The frontal bone. So these would be called the frontal sinuses. And then in looking at this picture here, this picture is on page 215. And then we have a smaller pair of sinuses called the ethmoid sinuses, because that's where the ethmoid bone is. And below that, we have the sphenoid sinuses. And these are the two that makes a person feel like their eyes kind of hurt. They have pressure behind their eyes, pain in the top part of their nose. And then some people even say their teeth hurt because of these sinuses in the maxilla bone. So these are the maxillary sinuses, the bone of the upper jaw. And if we look at a side view of these sinuses, I can show you kind of what those look like. Zero in on this one here. Here is the frontal bone, right? So this is a frontal sinus. This large space over the teeth would be the maxillary sinus. And then behind that, we have just above it would be the ethmoid sinus and then the sphenoid sinus behind it. So the ethmoid and the sphenoid sinus. Let's see if I can find another picture. Here's a nice color picture. They don't like to show. Okay, here, this one's a good one. So we have the frontal sinus here. And then the maxillary sinus, they don't show that very well, but they're very large, right over the top of the teeth. And then again, we've got the sphenoid sinus. And then in front of that is the ethmoid sinus, which isn't shown in this one. Jeez Louise. Okay, let's see this one. That's not a great picture either. We have a real skull here. I put it on Blackboard. I'll go to that because I think that's going to be our best bet. Let's see. All right, this is in Blackboard. So this is the frontal sinus. Then we have, and this is labeled here for you too, so there's no confusion. Frontal sinus, maxillary sinus, ethmoid sinus, sphenoid sinus. So the ethmoid and sphenoid are right next to one another. The ethmoid's in front, sphenoid in the back. The maxillary sinus is over the teeth, and the frontal sinus is in the frontal bone. So that's a picture in Blackboard for you. So now looking at the lower jaw, we've got the mandible, called the lower jaw. And the mandible is made up of two parts that you have to know. This large rectangular broad portion here is called the ramus. The ramus. And then this is called, where does that fit? Do you remember where that goes? Yeah, it fits right into the mandibular fossa of the temporal bone. So this is called the mandibular condyle. Remember we saw the word condyle on either side of the foramen magnum, the occipital condyles. So this is a grooved surface to fit in that mandibular fossa. So here's the mandibular fossa of the temporal bone, and here's the condyle. That bony, rounded portion is the mandibular condyle of the mandible. Then the top portion of the teeth, the upper portion of our jaw, is the maxilla. So it's shown in purple here. This is the maxilla. There's nothing more you need to know other than just maxilla. The ramus is this broad rectangular portion here. Okay, and then we're going to look at, so we talked about that, the maxilla. Now we're going to look at the palatine bone. The best view of that is this view here. This is your hard palate. So the palatine bone is that portion of the hard palate right before you get to the soft palate. So picture reference for this is on page 217. It's shown in green here, is the palatine bone. it's that back portion of the hard palate. Then it becomes soft palate, kind of squishy. So that's where that bone ends, is right there, the palatine bone. And then we have the zygomatic bone. So we need a front view again of the skull. The zygomatic bone is the round part of your cheek, shown in blue here. So both of your cheeks in the front, that bone is the zygomatic bone. Remember, that meets up with the zygomatic process of the temporal bone. But this whole bone here is the zygomatic bone. And it forms the bottom of the eye socket as well. So when someone gets punched in the face and they break that bone, they also often will break the lower portion of the eye socket as well. The person's face gets really swollen. Then if we look at a front view of the skull, again, go back here, we have a couple more bones of the face, which is the lacrimal bone. The lacrimal bone is on the inside of the eye socket, and if you look down at the base here, there's a little hole there, and that hole is for the tears to go into from the eye to the nasal cavity. It's called the lacrimal duct, is what is in that little hole. It's not shown in the pictures in your textbook, but there is a little hole on the inside of the eye here where the lacrimal bone, at the bottom of the lacrimal bone. And to tear up is called to lacrimate. So that's where that comes from. Tearing it has a prefix LACR. So this green rectangle, very small rectangular bone on the inside of the eye is the lacrimal bone. Question? The palatine bone is this green bone right here in the back of the upper palate. Okay, so that's the lacrimal bone. Then we have the nasal bone, and the nasal bone is what forms the bridge of the nose. So this is shown in blue here. That's the nasal bone. And these are fused bones. You see a line in between there? That's just because they're two bones that fused. You can't feel that separation anymore. And then if I look inside the nasal cavity, so if you take a look at your skull and just look straight in that nasal cavity, you'll see there's a bony separation in between that divides the nasal cavity into two halves. The bottom half of that separating wall is called the vomer. So it's shown in blue here. So you have to look inside the nasal cavity. You'll see it kind of has a V shape. When you stick your finger in there, it goes up and then it comes back towards you again. So the blue and the orange, dividing wall in the center of the nasal cavity. The bottom portion is the vomer. The top portion is the ethmoid bone. So we're just looking at the vomer here. The bottom portion, the blue. All right, questions on the vomer? It's kind of a tricky one. And then on the outer walls of the nasal cavity, coming down here, we have the superior and inferior, but you don't have to know superior, inferior. All you have to know is these curled bones that come off the lateral walls of the nasal cavity. They're called the nasal conchae. So here's one and here's one. There's one over here and here. Nasal conchae. And they're lined with a mucous membrane, and they just provide some turbulence to the air as we inhale into the nose, and it causes the debris in the air to stick to that mucousy membrane and traps it so it doesn't enter into the airways. So the nasal conchae just provide that turbulence. And a conch shell is a shell that's kind of curled, and that's where it got its name from, because these nasal conchae kind of curl to the edge a little bit. If you look in a real skull, it doesn't really show that in this diagram though. All right, then we're on page 11 now. We're going to look at the sutures, which are the fused separations between these skull bones. So we have between the frontal bone and the parietal bones, we have this suture here. It sits on the head like a crown. That's why it's called the coronal suture. So the coronal suture divides the frontal bone from the two parietal bones. So if I look here, I can see the coronal suture sits on the head like a crown at the back of the frontal bone at the start of the parietal bones. And then running down the center of the skull on the top, beyond that, so from here to here, back here, is the sagittal suture. Let's see, do I have a top view? I don't know if I do. The sagittal suture is at the top. Here we can see it coming down the back side here as well. So that's the sagittal suture, divides the two parietal bones. And then in the back, separating the parietal bones from the occipital bone, is the lambdoid suture. Some people felt it looked like the Greek letter lambda, which is like an upside down V with a little line coming off the top. But the only portion that's the lambdoid suture is this portion. It outlines the occipital bone. It might be a good idea to label these according to what they border. So lambdoid borders the occipital. Sagittal separates the two parietal bones. And the coronal suture separates the frontal bone from the two parietal bones. Then on the side of the skull, we have the sagittal suture, which is here. This suture outlines the temporal bone. It's a margin at the top of the temporal bone. So that's the sagittal suture.
What was the big one?
The-
You said that was the sagittal.
Oh, I'm sorry, squamous. I thank you for correcting me. Yes, this is squamous. Sorry, word soup. Squamous suture. This is the squamous. Sagittal is at the top, separates left and right sides of the skull, right? Parietal bones. So coronal, sagittal, lambdoid, and squamous on the side. Thank you for correcting me. Sometimes my mouth is not connected to my brain. Okay, the next is looking at the fetal skull. So if we look at the top view here of the fetal skull, we see the frontal bone, the two parietal bones, and we see the occipital bone in the back. So we're looking at a top view of the skull here. So these sutures are not formed yet because we want this little tiny baby head to be able to grow and expand, for that big brain to grow and that head to grow. And this expansion is almost complete by age 2. So these separations here are going to be fused and gone by age 2. So that's why when you look at a 2-year-old, they kind of look like they have a little body and a big head, because their head is almost completely grown at that point. So if we look at this first suture then, because it is near the frontal bone, it's called the frontal fontanelle. So this space right here, it's a connective tissue covering over the brain, kind of about as thick as a canvas is. So it's a very thick covering, but still, you know, if you hit that hard enough, that can do damage to the brain. So that's the frontal fontanelle, or the anterior fontanelle, because it's closest to the front of the body, front of the skull. And then in the back here, between the parietal bones and the occipital bone, is the occipital fontanelle, or you can just call it the posterior fontanelle. So you have the frontal fontanelle or anterior, and occipital or posterior fontanelle. Now if a baby is fluid overloaded or has fluid over the brain, you'll see these fontanelles bulging. Sometimes when a baby's crying really hard, you can see it pulsing with their heartbeat. That's normal, that happens. If a baby is dehydrated, you'll see a sunken fontanelle. That's a bad sign, very bad sign, because that means they're low on fluid, and really low to the point of having a sunken fontanelle. And then if we look at the side view, where these skull bones come together, we have the, well, if we look at the bones that make up the skull, the mastoidal fontanelle and the sphenoidal fontanelle. Which one is more toward the front of the skull? The sphenoid bone or the mastoid bone? Mastoid bone was down here. Remember the mastoid process down here by the temporal bone? So this is the sphenoidal sinus. Or if you don't like to remember sphenoidal, you could say it's toward the front, so it's anterior, but it's on the side. You could call it the anterolateral fontanelle, because it's toward the front, on the side, anterolateral. And this one back here, instead of calling this one the mastoidal fontanelle, you could call it the posterolateral fontanelle. So sphenoidal fontanelle or anterolateral, mastoidal or posterolateral fontanelle. Okay, then we're going to go down into the spine now. every vertebrae of the spine has a few things in common. So objective number 5 is just looking at common features of every segment of the spine. So every spinal, every vertebra has a body, which is here, that enlarged end. And if you look at the spine picture, what divides the bodies? What is in between there? What do we call those pieces of fibrocartilage between the bodies of the spine? What? Yeah, a disc. You've heard of herniated discs, right? So it's called an intervertebral disc. It's what divides the different vertebrae of the spine and gives flexibility and cushion for us to move our torso. Some people get herniated discs and they have to go in and clean those out and fuse those segments because they just don't function correctly anymore. But the body is where those discs are located. So this is the body. And then we have the vertebral foramen, so this huge hole, like we saw the foramen magnum, continues down into this region. What goes in there? Spinal cord is in the vertebral foramen. Then we have the spinous process right in the middle. And that's those bumps on your back when you bend over. So the ligaments and muscles, tendons of the back attached to these processes. Then we have the transverse processes on either side, kind of sticking out like arms. There's 2 of those transverse processes. We see these really long in the thoracic region behind the ribs because they articulate with the ribs. So we see those really prominent there. And then the lamina is the supporting bone between the spinous and transverse processes. So this region here is the lamina here and lamina here. It forms the top portion of the vertebral foramen is the lamina. And sometimes when people have a lot of swelling and damage and the spinal cord is compressed, they'll do what's called a laminectomy, which means they'll go in and remove bone here to allow space for that spinal cord so it's not compressed and causing damage. And then again, we talked about the intervertebral disc. So each one of these little blue structures here is fibrocartilage, is the tissue, and it's called an intervertebral disc. So when we get into the spine then, we can look at a couple of things, and one thing that we look at is the groupings. So the group in the neck, shown in blue here, is the cervical region of the spinal column. So that's the cervical, and you have to not only know the name of the region, but also the number of vertebrae in that region. So there's 7 vertebrae in the cervical region of the spinal cord. Then we get down to the thoracic region, and the thoracic region is where the ribs come off. And there's 12 vertebrae there. And then the lumbar region is down here at the bottom, the lower back, where the spine curves inward. You can see that. When we look at the side view of the spine, it's like a flattened S. So that inward curve is the lumbar region, and there's 5 vertebrae there. And then we have some fused bones. You don't need to know how many fused bones. Just know this whole bone here with the holes in it. This is the sacrum. This is the sacrum. So when a person is sitting in the chair or laying in the bed a lot with the head of the bed elevated, they can sometimes get bed sores in this region. And also they can get them on the buttocks too, right at the top of the gluteal fold or the butt crack, for lack of a better word. This is the coccyx. The coccyx. So these are 2 major bony portions where there's thin skin that can cause bed sores. So we always have to check our patients to make sure they're not sitting too long and getting a bed sore over those bony parts. So a good way to remember how many is in each region, you only have to know the 3 major regions, cervical, thoracic, and lumbar. Think if you worked at a bank, you would eat breakfast at 7, which is the cervical, lunch at noon, or 12, and dinner at 5 for the lumbar. So 7, noon, and 5. All right, so now let's look at, so what bone is this? This is the sacrum, and the little bone at the bottom, we call it our tailbone, the coccyx. So it has a hard C followed by a soft C, coccyx. All right, now we're going to look at the first 2 bones of the spine, which is the atlas and the axis. So this is the atlas, this is the axis. And if you look at the atlas, it kind of has a look like a turtle face, or some people say it looks like Sid from Ice Age. But that's the first segment of the spine. And here's these condyles. Remember the occipital condyles of the occipital bone? That's where the skull sits and rocks back and forth, or up and down, I should say, up and down, to allow you to say yes. And then this is the axis, and this little pointy part sits inside of this when I put these on top of one another, and the skull rocks on this kind of pivot point here to allow you to shake your head no, to move your skull back and forth. So I can I can form a circle with my nose, moving my skull because of the points of the atlas for the rocking up and down, and then the points of the axis where I can go back and forth with the skull. So this is the axis. It kind of looks like, if you can turn this thing upside down, it looks like a football player. Here's the head of the football player. Here's the shoulder pads, and here's the arms or hands down on the football field. Can you see that? That's a good way to distinguish that as the axis. And then, like I said, the atlas kind of looks like a monkey face or turtle face, any of those. So then, so that's the cervical vertebrae, but it's 1 and 2. So our first two. And then if I look at lumbar and thoracic vertebrae, what animal do you see if I look at the lumbar vertebrae here on the side versus this one? I see a moose here, yeah. So the really big body and the short spinous process, that's characteristics of the lumbar vertebrae. So look for a moose when you hold that to the side. And then the thoracic vertebrae, where the ribs are, and the muscles of the arms and back, we see this long spinous process, and it kind of looks like a giraffe. So that's the thoracic vertebrae. So if you just see one single vertebrae sitting there and you're not sure, just turn it to the side and you can see the difference. One looks like a moose, which is the lumbar, and the other one looks like a giraffe. Okay, so then that leads us to the spine, or I'm sorry, the rib cage. So if I look at, I'll pass these around to look at. If we look at the rib cage, we have 12 ribs. Starting from the top, we can see that the first 7, if I count 1, 2, 3, 4, 5, 6, 7, these first 7 have a direct connection to the sternum via some cartilage. Can you see these cartilages here? And this is hyaline cartilage. So they have a direct connection to the sternum. So we call these first 7 ribs true ribs. So they're the first 7. There might be an error in your lab notes. If you're looking at the filled-in lab notes, I think it says the first 8 are true ribs. Does it say that? Or did we fix that?
1 through 7.
Okay, we fixed it. Okay, so it's ribs 1 through 7. And then the false ribs are ribs 8 through 12. So I can see that this rib here is riding in on the cartilage of rib 7. So this is rib 8, 9, 10, 11, and 12. And some of those ribs are even not attached at all. We call them false ribs, but you don't have to know false ribs. You just have to know true rib versus false rib. So the first 7 are true, 8 through 12 are false. And then looking at the sternum, the parts of the sternum, there's 3 parts. It kind of looks like a necktie, doesn't it? The top portion is called the manubrium, the manubrium. So I always think of like only a man knows how to do that tie, because women don't ever do those unless you had to wear a suit tie for like working at a restaurant or something. But that's called the manubrium. And then the main portion of the sternum is called the body. So the portion, hanging down part here of a necktie, the body. And then this little extension off the bottom of the sternum is called the xiphoid process. And just below that is where you want to do like the Heimlich maneuver we talked about if you took a CPR class, or you will take. That's the xiphoid process. Starts with an X. So again, there's flashcards that I use to present this material. So print those off, fill them out. The sooner you review these, the easier it's going to be to get them down.